Hey, it's Philip here with another update on our novel ventilatory aid device. Now that the COVID pandemic is thankfully reaching its conclusion, there's a number of emergency mechanical ventilators that are being shelved. And the reason for this is that these ventilators were invented to keep up with the foreseen shortage of proper ventilator devices. This shortage never actually happened, and as such, these projects are being shelved in favor of more pressing concerns. All of these ventilators operated on roughly the same principle: mechanical actuation of a BVM. A BVM, or bag valve mask, is a common medical aid tool that's found in almost any ambulance, first aid kit, trauma kit, really anywhere where you might need some sort of medical tool to address someone that has respiratory distress. And what a BVM is it's a bag that you squeeze by hand in order to deliver air to the patient. Now, these devices all operated on roughly the same principle. They had a mechanical actuator to squeeze the device to deliver air to the patient instead of, doing it by hand. The problem is that this only fulfills one of the functions that a real ventilator does, and it's incapable of handling the workload that a proper ventilator device can do. As such, it's only useful in very certain edge cases in the COVID pandemic, and they didn't see much utilization nationwide or even worldwide. Our device works on completely different principles. It works on the principle of pneumatics. By placing the same BVM inside of a pressurized air chamber, we can both deflate and inflate the mask using changes in air pressure. This allows us a greater degree of control of the breaths that are delivered to the patient, since by inflating the mask faster than it would by simply absorbing atmospheric air, we can actually change the volume and speed of breaths that are delivered to the patient. However, the most important addition to our device, and the one that distinguishes it from other emergency ventilators, is the fact that we have a vacuum ejector that removes air from the patient during exhalation. This allows us to enhance exhalation processes of the patient, not just inhalation processes like other emergency ventilators. Exhalation is the active part of breathing. That's the part that's damaged first when someone has impaired lung function, and as such, it's the most important part of the ventilatory process. Our device can enhance someone's natural exhalation processes and allow them to restore normal breathing function. This is not just useful for COVID, it's useful for a number of other things. You can use it for recovery from thoracic surgery. You can use it for pneumothoraxes, punctured lungs, something that would compromise lung function, and you can enhance exhalation and allow someone to deal with that. This makes our device not just applicable for COVID, but applicable for a number of other situations, and especially situations in which someone has a punctured lung and they need to be able to breathe while they're moved to a certain trauma center so that they can be treated. This makes our device incredibly applicable in combat situations. In that very specific time frame that's very critical, from the moment of injury to the moment of care, our device can keep someone alive while they're delivered to a hospital or a trauma center where they can be properly treated. This means that our device, which is cheap, modular, and can be operated by the patient themselves in an emergency, is one of the things that can save lives out in the field. And as such, we're looking for contacts within the Armed Forces or the Department of Defense to see about implementing our device as a first aid response in cases of combat injuries that are specifically dealing with compromised lung function, things like gunshot wounds or punctures or something like that. Our device can save lives, and that's why we just wanted to give this update as to where we're going with our prototype and our plans for the future.